I thought I would speak a little bit about what the Bill and Melinda Gates Foundation does, recap a few things about global development today, come to maternal and newborn health examples, and then sum up. Starting with the Bill and Melinda Gates Foundation, women and children are at the heart of what the foundation does. If we look at the international work of the Bill and Melinda Gates Foundation, it's really organized around women's health and empowerment and children, as I symbolize in this drawing. Women hold up half the sky. We are speaking about saving women from maternal deaths. When you come back to a family that has lost the woman in childbirth, 2 years later, the family is gone. You have excess mortality of surviving siblings up to age 10, 80% excess mortality. The mortality of the woman in childbirth and the family mortality is closely linked. But we're also speaking about empowerment of women, how women in societies can be empowered to change their societies. And that's the basic assumption and belief in our foundation. So what we do around these goals is around maternal, newborn and child health, where I'm working, but we work closely with health systems. As was shown by Marlene, you cannot achieve quality if there's not water in the facility, if you don't have soap, if you don't have the drugs you need, if you don't have the midwives you need. So that's about health systems. There are also aspects around nutrition, immunizations, and family planning is closely linked to maternal health and newborn outcomes. But around these is a broader set of issues of the communicable diseases, TB, HIV, malaria, the gender issues, water and sanitation. Financial services for the poor, in our definition, is about getting women access to smart money by cell phones so they can access their rights. Our financial services for the poor investments, which are actually going quite well, having women control their own monies, the salaries of their monies they make, online banking, and this is all about women and goes to women. Agriculture is an important area to invest in if you want to improve nutrition. If we're not speaking nutritional supplements, well, what we grow on the soil is very important to address. And then research and policy and data. So we spend about $5.5 billion a year, which is a lot, but I wonder if not the voice of the Bill and Melinda Gates Foundation is even more important. That Bill and Melinda, our co-chairs and our leaders, they get access to speak to the presidents and the prime ministers, not only the ministries of health, because they donate their fortune to the goals you can see symbolized in this slide. So actually $5.5 billion sounds a lot. It's about half of what the country I know best, Sweden, half of what Sweden gives in overseas development assistance. So it's not all that much. It's a lot of money. But the question is if the way the Gates Foundation works with the voice changing global policies is not even more important. I'm coming to that. So I'd like to ask you a question to start with. I'm leaving the Gates Foundation. I'll come back to that at the end a little bit. But I'll ask you a question. How many children will there be globally in 2001 at the next turn of the century? Is it scenario A, where you see there will be about 4 billion children? Or is it scenario B, 3 billion children? Or is it roughly 2 billion children, scenario C? Can I ask you very quickly to raise your hand? Who says scenario A? Scenario A, please raise your hands. Scenario B, and scenario C. I'm glad you are well informed, young people. The scenario C is the correct one. The number of children under 5 or under 15 is no longer increasing in the world. It is no longer increasing. We reached the climax around 2003. So we can discuss why population increase continues for another 50 to 70 years, but the number of children is not increasing in the world. So that was just a test. Many of you passed the test. The others have to go back and read some global health. Let me remind you very quickly our background. In 1960, in the world, based on UNICEF data, 217 children out of every 1,000 did not celebrate their 5-year birthday. They died before. Almost 1/4, roughly 1/5 of all children died before their 5th-year birthday. From 1960 to 1990, this falls in exactly half. So 107 children in 1990. If you look at 1990, 107 children survived. Can you see how we cut under 5 mortality in half in the world over 30 years from 1960 to 1990? Then came the MDGs that Marlene has spoken about. That was 25 years. So from 1990 to 2015, it fell by more than half again. So that is what we have achieved in the world. Now, the SDGs have an even shorter period, 1960 to 1990, 30 years, 1990 to 2015, 25 years. Now we have 15 years, and now we're getting out there to try to cut under 5 mortality in half again, and this time in 15 years. Will we do it? At the same time, total fertility rate, and I'm sure being so well informed as you are, you know that replacement level is 2.1 children per woman. And we are down now at 2.2, 2.3. So we're almost at replacement level. A country like Bangladesh, we have a Bangladeshi professor here in the audience. Bangladesh has reached replacement level. Huh? But this doesn't do justice. It doesn't explain the differences in the world. Because at the same time that this is true, Africa will see a population increase of doubling until 2050 in many countries, and doubling again until the next turn of the century. So this is an average figure, but it doesn't really help us understand the challenges of Africa. Now, eliminating the poverty, very much of maternal mortality and child mortality is linked to poverty. And it could be that we, in the MDG era, have picked the low-hanging fruit. So to cut child mortality by half in 15 years may not be possible if we don't work very, very hard. Because poverty has gone down. You can see the absolute poverty, the bottom billion people. The bottom billion people, they are there. And who are these people? These are the people without any services, as you saw in the Ebola crisis. These are the people living in the villages of northern Nigeria. And since there are no services, Boko Haram gets supporters. These are the people living in Somalia. These are people living in refugee camps, and these are people living in slums. And that's where we have the challenge in the next, now only 12 years of SDG, that we may have had a less challenging journey from 1990 to 2015 than the 12 years we have ahead now. Because now we must concentrate more on these vulnerable populations, the bottom billion. Because if they don't get services, this will serve to cultivate terrorism. And these people also have a much, much higher fertility because they're not convinced that their children are going to survive. So therefore, they get not 2.1 children, they get 5 or 6 or 7 children. So our challenge in the next 12 years, 3 years have already gone of the SDG era, is to change gears and work even harder to eliminate poverty and actually then also invest more in women. So the global maternal mortality, Marlene already spoke about that. I'll skip that slide. Why did maternal mortality go down? Well, amazingly, we have seen a change in the ecology of human birth in the last 20 years. Countries that just 20 years ago had most deliveries at home have now changed and have all these deliveries in the facilities. Malawi has 90% facility births. Democratic Republic of Congo has 85% facility births. And this huge change that you can see in this graph in the last 20 years, Lancet publication, is what explains the poor quality. The system has not followed with resources. That is why the soap is running out. That is why women are giving birth on the floor. That is why there's not enough midwives. So this, that women come to facilities in good faith to have birth attended with quality care, That is not happening to the extent we would want it, but it explains the decline in maternal mortality. Now let's just think about this. Marlene and I started as obstetricians. For us, what can we do? What could we do in Mozambique in 1978 when I came there 40 years ago? What could I do about the home births? Not very much. You can make it safer for the newborn, but it's very difficult to make it safer for maternal death because the bleeding or the preeclampsia, the eclampsia, the sepsis, they're very, very difficult to treat at home. Now the women have come to facilities. Now it's our responsibility to improve that care for them. Let me just give a few examples of what we can do. Right now we're working very hard on postpartum hemorrhage. If you remember Marlene's slide, the biggest individual cause of maternal death, direct obstetric death, is postpartum hemorrhage. Most of the women who suffer postpartum hemorrhage, they don't have any risk factor. You can't predict it. It comes like a lightning bolt from the sky. Relampago. Suddenly the one that bleeds 1 liter, 2 liters, and she dies in your hands as this blood is rising on the floor. And what can we do about it? Now, in the last 5 to 10 years, we have a couple of very, very cheap interventions. You see one in this slide. With these, we can save 97% of the lives of women who are suffering from severe postpartum hemorrhage, who are in shock at the primary health care level for devices that cost less than $4. I can repeat that, but we're working very hard on this. We're working very hard on the Gates Foundation. If this is one of the last things I'm going to do in my professional life, it's make these devices get out there. I'm speaking about tranexamic acid. I'm speaking about the non-pneumatic anti-shock garment. And I'm speaking of the assembly, the little plastic bag of the intrauterine balloon tamponade, $2.85. Saves 97% of the lives of women in shock, meaning a systolic blood pressure of 90 or unconscious. They're dying, they're slipping out of our hands. I saw it in Beira. I suffered it. They suffered. They died in my hands, some of them. Now we can do it. This is what we're going to do in the next couple of years. We're going to eliminate these postpartum hemorrhage deaths because we have the weapons. Neonatal mortality is also falling. Much to do there. Women are coming to facilities. We have to work hard on that. Let me sum up. What we need to do is newborn and child survival. These are very closely linked to fertility decline and to women's empowerment. These things belong together. It's a multi-pronged approach. You will need midwives, you will need obstetricians, but you also need policymakers and planners. You need district planning, you need to resource, but it's also about women's rights to financial autonomy. You saw the male engagement in Marlene's beautiful clip. These are the things that we need to invest in, and we also need to invest jointly in these to acquire the safety and stability by addressing the bottom billion. Let me sum up. There have been huge changes in the world in the last 50 years. I showed you from 217 per thousand to now less than 50 per thousand, under 5 deaths. Last 25 years, this has accelerated. We can eliminate absolute poverty. We can reach that bottom billion if we really want to do it. But this requires reducing child and newborn deaths and decreased fertility to eliminate the poverty. We have a change in ecology of human birth. When I was young, most births were at home in many poor countries. Today, most births are in facilities. It competes to us to improve the quality and resourcing of them. The quality of care needs to improve so that we can really get the decline in maternal and newborn mortality. The SDGs for maternal and newborn mortality are definitely within reach. Here's a couple of key aspects for us at the Gates Foundation. We have the global financing fertility. That's the new kid on the block. Currently, 27 countries are making financing plans and investment cases where we try to support the resourcing of reproductive health care. Read up on GFF. That is how the Gates Foundation works in strategic global partnerships. We were the co-founder of Gavi, the Global Alliance Vaccine Initiative, FP 2020 mentioned by Marlene, H6, that's the UN organizations. We don't have all that much money, but using the voices of Bill and Melinda to enter into these partnerships and try to mobilize and leverage other partners. We definitely need quality of care work, as Marlene says, poverty reductions, and we need to target those vulnerable populations. So our new strategy is very much about this. We have revised our strategy on MNCH in the last year. We have worked hard on this and are going to be even more focused in the coming years. I won't bother you with the text. I would just instead say that Bill and Melinda Gates Foundation sees this as a core priority: maternal, newborn child health and empowerment of women. That is what we are all about. Thank you so much for your attention.